Hello everyone, I am Dr. Advait Kulkarni. GBS or Guillain-Barré Syndrome is rare but often serious neurological condition which affects the nerves. It is an autoimmune condition which affects the nerves in the legs and hands. Initially leads to tingling and numbness in the hands, pain in the hands and legs, which is subsequently followed by difficulty in walking, which may be evident by difficulty in climbing stairs, difficulty in getting up from sitting position, difficulty in mixing food, eating food, buttoning, unbuttoning, etc. So these are often progressive neurological symptoms which need a urgent evaluation by a neurologist. So there can be different symptoms of Guillain-Barré syndrome, like as we said, tingling in the hands and legs, numbness, motor disability, difficulty in walking. Also, there can be autonomic symptoms like a sudden increase in heart rate or decrease in heart rate, sudden increase in BP or decrease in BP. Also, pain is a very important and prominent symptom in Guillain-Barré syndrome. Guillain-Barré syndrome or GBS is a rare neurological disorder and it is often more common in males and it can affect all the age groups, but it is more common in adults. What are the common causes? The exact cause of Guillain-Barré syndrome is not known. However, it is supposed to be an autoimmune disease where the antibodies which are produced against some other virus or bacteria act inadvertently against the nerves in the legs or the hands, which leads typically to paralysis, weakness, and various sensory symptoms. This is often described as molecular mimicry, because of which the autoimmune disease GBS is often a progressive disease and needs urgent evaluation by a neurologist and treatment as soon as possible. I got a call from my friend in Goa who is a doctor that his brother is experiencing sudden symptoms of numbness in his hands and legs and difficulty in walking just from yesterday. I said, "Oh, then let him just meet me." After meeting him, he had all the typical symptoms of GBS. He was not able to climb the stairs. He was often falling while walking, and he was most likely suffering from GBS. So, how do we diagnose GBS? The first and foremost is a clinical examination and the symptoms of the patients, which need to be understood in detail by a neurologist. The tests are supportive in diagnosis, like nerve conduction test, which tells us what kind of neuropathy, whether it's a demyelinating or a axonal neuropathy, which helps us to prognosticate the disease. The second is a lumbar puncture, which also helps us to prove the diagnosis. The third is a MRI, which is occasionally used to rule out other causes of the weakness. What is the treatment? The most important is to start the treatment as early as possible once the diagnosis is confirmed. The mainstay of treatment is IVIG, that is intravenous immunoglobulin, which acts against the antibodies which are acting and causing nerve damage. So we can call it as antibody against antibody, that is IVIG injection, which is often given over 5 days. The second treatment is a plasma exchange treatment, which is similar to dialysis, whereby the process of plasma exchange, we remove the unwanted antibodies which are causing damage to the nerves. And of course, supportive care is very important, like physiotherapy, occupational therapy, treatment of other complaints like pain and tingling, and encouraging patient and giving him confidence that it's a treatable disease and it's absolutely possible to come out of this problem.